today. I'm excited to introduce the two speakers today. The two speakers who are no strangers to you, the local speakers. And very pleased to introduce Dr. Mark Gilbert, who is an associate professor, a partner track in our school. And he is currently also spending a lot of time in the school, even though it's partner track, because he has a public health chair, which is a very prestigious chair. And I see him in his office with his headphones on, door closed. So either he's listening to some really good music, or he's just shutting all the noise out so that he can just concentrate on his work. But he's definitely way more focused on his work than I am. I have to get up and walk every 35, 40 minutes. Dr. Gilbert is also a scientist at the BC Center for Disease Control Research Center at BC's Center. And he holds, like I said, this public health chair. And his program of research is focused on equitable and sustainable implementation and scale up of STBBI testing. For those of you who don't know what STBBI is, it's sexually transmitted bloodborne infections and digital public health. He's got a big multidisciplinary team he leads, and he works alongside community members. So he's got a big responsibility. And of course, I think working in a busy place with a huge team makes it difficult to do research. And I think he appreciates his time away to be able to work as a researcher here. Our co-presenter is one of our own graduate, Dr. Ihoghosa Iyamu. Is a postdoctoral student at SPPH. He's also a Health System Impact Fellow, BC Center for Disease Control. These are special awards, hard to get after your PhD to do a fellowship. He's almost finished, and I'm looking forward to having some discussions with him about his future career paths and future career choices. So over to you guys to talk about emerging concept of digital public health, its competencies, and the future of research training in this critical field.
Thank you, Aslam. And thank you, everyone, for coming this morning in person or online to sort of hear Muyi's and my thoughts around digital public health. And just to explain a little bit, that Muyi and I are co-leads of a project called, what we're calling the Digital Public Health Project, which is part of my research initiative, the Digital and Sexual Health Initiative at BCCDC. This is an area we've been thinking about for a while and are excited to be sharing this with you today. Oops. Oh, there, okay, all right. Thanks, Aslam, for the land acknowledgement also, so I won't spend much time on that, but just to acknowledge that, here today we're on the traditional unceded territories of the Musqueam Nation. We're very privileged to be here and grateful for their custodianship of these lands. So you may be wondering why I have a presentation about digital public health and why it's important, and that's part of what we're going to be talking about today. And one reason you may be thinking why is like, why now? I mean, and it's true that public health has really been grappling with digital technologies and digital environments since really the early days of the internet. So a couple examples here on the left is the Global Public Health Intelligence Network, which was formed in the late 90s and now operated by PHAC, sort of a global intelligence source around emerging public health threats. In my field, the STBBI area, one of the sort of the landmark events was in San Francisco when public health nurses went into a chat room to conduct an outbreak investigation related to syphilis. That sort of heralded this sort of idea of the online space and the importance of thinking about digital technologies. And in fact, the image on the lower right is sort of reflective of BCCDC had the first nursing-led program that was a cyber outreach nursing program that was doing similar work going to chat rooms and forums. And so I think, and in many parts of public health, we've all been working in the digital space for quite some time. But digital public health is something increasingly that's getting talked about, and it sort of is a little bit of a buzzword that people refer to in shorthand, but there's not really a clear understanding of what it means. And that, in part, is sort of what we have been trying to understand. If we took the time to go through the room and ask people kind of like what came to mind when you thought about digital public health, we'd probably hear a wide range of different things coming up. We'd hear about digital health promotion, social media, we'd hear about artificial intelligence, we'd hear about digital literacy, and so on. And I think it's important for us to think about what connects all these things together and how do we think about this space of digital public health. In thinking about this image, that sort of captures kind of our thinking around digital public health, right? Is that we know that there's many different components that add up to sort of the bigger picture for the elephant in this case. And so the project that we've had, the Digital Public Health Project, has been trying to really understand and define this elephant. Like, what is this body that kind of connects all this different work together? And I think the people is also illustrative of that there are multiple people in public health, probably many people in this room and online, who are really doing work in this space. And that there's many different kind of entry points and viewpoints into thinking about digital public health. And we by no means consider ourselves the expert in this, but just trying to think about ways to organize. But those entry points are important to think about. And so we're just reflecting a little bit to share with you kind of our two entry points into this area. So this, for me, this really ties to my work as a public health physician at the BCCDC. And actually, starting at BCCDC, it was Gina Ogilvy at the time who had the foresight and the vision to be thinking about online sexual health services, and actually wrote that into my job description. But I really got involved in this area of online sexual health interventions, leading to the development of two provincial interventions, the Smart Sex Resource educational website, as well as Get Checked Online, which is BC's internet-based testing program where people can get tested for STIs without needing to see a provider. And so from that practice perspective, I learned a lot and was thinking a lot about sort of what this meant and how you did this kind of work. And then on the research side, I've had a parallel program of research that's really been studying various aspects of us doing work in this space through the Digital and Sexual Health Initiative. So it's really that combination of the research and the practice, which is sort of my entry point into this space. Turn it over to Muyi just to talk about.
So I'll just talk about my own entry points. And so I think in 2018, I was working in public health as a physician on a large-scale HIV program called SIDHAS, Strengthening Integrated Delivery of HIV and AIDS Services. And I started realizing the need to leverage digital technologies to improve efficiency of service delivery. And so you see apps we deployed to increase the efficiency of testing, reduce needless testing within communities, and improve the yield of testing, as we called it at that time. We also deployed a number of interventions for education, health education. And I started thinking, we could think about this also in terms of engaging and empowering people to get tested by themselves. And that's how I got to know about Get Checked Online, and luckily got to do a PhD dissertation on Get Checked Online. And during my time there, I actually participated in the DFP, Designing for People Research Clusters Fellowship. It's called DFP Create. It's out of the Computer Science School. And I realized the power of inter and transdisciplinary practice at the time. I was the first student from SPPH joining that program to understand how to leverage technologies and design in a way that can be people-centered. So we started thinking, how can this be applied more broadly in public health? And that's my entry point into this subject.
So that brings us to our objectives for today. We kind of have three objectives: to describe to you the research we've been doing about thinking about digital public health and how it's relevant to contemporary public health practice. Muyi is going to spend some time reviewing findings from a study that he designed and led, looking at digital competencies and training approaches to support the next generation of public health practitioners and researchers, which we felt was a relevant thing to be talking about here at the School of Population and Public Health. And to talk with you and hopefully discuss with you, share some of our ideas and hear from you your ideas about how we can move forward in this area of research and practice around digital public health. So what is digital public health? So we started talking a little bit about this as sort of like idea of digital public health, but what does it really mean and how would you define it? And these were actually questions we were asking ourselves at BCCDC as we started thinking about these technologies and their relevance and how they applied more broadly than just in the area of STPBIs. And so one of the first things we did was we had a small grant from the Pacific Public Health Foundation to do a scoping review, which was really focused on looking at, what is the definition, what is the scope of digital public health, what are some of the challenges and opportunities that are discussed about with digital public health. And our focus here was on literature that was not sort of studies of interventions, but really looking at literature that was sort of presented public health perspectives that were conceptual or a bit more thinking about this idea of digital public health. And because no one was really using that term, we used a search that sort of meshed digital health and public health terms and looked at that intersection using the ARC-CDMLE framework. And of over 7,000 publications that we screened, we sort of wound up with about 227 articles to review that were part of our scoping review. So one of the first steps in the scoping review is kind of charting the literature, and this is a heat map which sort of shows the distribution of the articles at that time, which were, I should mention, the literature search was between January 2000 and June 2020. So this was the time frame that we were looking at. And you can see just the public health domains are on the left, or at the top, sorry, and different digital technologies down the left. And while you can see the red sort of indicates the number of articles, and while there's sort of a tinge across many parts of the heat map, at that time in the literature, there's clearly a couple of spots where people are focusing most of their attention around digital public health. And that is surveillance and epidemiology and health promotion. With the technologies that were most commonly being talked about being big data, informatics, mHealth, and social media, sort of examples of things that were really common in the discourse around this area of digital public health. In sort of trying to think about how people were defining this and looking at different ways that people were talking about different elements of digital public health, the two sort of most relevant perspectives that came out of this review were digitalization and digital transformation. So digitalization, and here's an example of a definition of digital public health that adopts that digitalization perspective, is really thinking about how digital technologies are applied to the existing work of public health. So in this case, digital technologies are another tool that we use to do our work in public health. The other perspective being brought to this was digital transformation, which was sort of more thinking about the need to kind of disrupt our existing public health processes and think about how we need to orient ourselves in response to the accelerating and rapid societal transformation, as well as people's expectations of society, and thinking about what this means for the delivery of patient-centered, people-centered kind of services and at its core. So because we didn't get a sense of, it wasn't a clear convergence within the literature that we looked at, we felt it was important to do sort of that final step of a scoping review of validation. And we did this through two means. We were fortunate to partner with the National Collaborating Center of Determinants of Health and hosted an online knowledge exchange. This was in November of 2022. The NCCDH had a really strong interest in digital equity, digital health equity, and that was sort of a bit of a lens in which this was brought to this exchange. And it included about 40 or so public health practitioners from across Canada from various disciplines. It was disseminated through a number of different public health practice networks. The other validation that was done was more of an internal validation. So at the BC CDC, we've had a digital public health working group for a number of years that's been just sort of talking about this and figuring out, these are folks who are doing more work with digital technologies. And this was another source that helped us sort of think about how to refine our findings. But before I tell you sort of the final definition that we came to, I think you may have already realized that, stopping your literature review in the June of 2020 misses a pretty obvious landmark in terms of like how digital technologies have transformed public health, and that's the COVID pandemic. We all know there's been an explosion of digital technologies, both sort of reamping and upping technologies that existed and development of new technologies. And this has sort of fundamentally changed the practice of public health. Similarly, the pandemic brought sort of this new attention to an emphasis to the importance of misinformation and disinformation, for example, around the COVID-19 vaccine. And at this time, people also started, I think, recognizing and talking more about digital health equity and thinking about the social justice and equity and ethical implications of digital technologies in the practice of public health. And this is an example of a paper actually that the trainees on my team conceived of and led and sort of published at that time. And other folks were thinking about this as well. So with all of these These also then led to sort of like a bit more sort of organization in terms of public health thinking about digital technologies. This is from Teresa Tam's 2021 report as a Chief Public Health Officer of Canada in terms of the vision of transforming the future of Canada's public health system, recognizing that medical and digital technologies were one of the 6 fundamental building blocks for really informing and supporting public health practice going forward. So perhaps unsurprisingly, when we went out to talk to folks after, like this was during that, like in 2022, like after a couple of years of the pandemic, these perspectives were brought to the discussion. And so the final definition of digital public health was based on these discussions is as follows, which is that digital public health is the use of digital technology to transform the delivery of public health functions in people-centered ways to optimize health outcomes for all. And that it brings together expertise in health, technology, and other disciplines, that sort of multidisciplinary transdisciplinariness that Muyi was mentioning, to improve the health of populations, while also addressing modern public health challenges that are amplified through the rapid and widespread uptake of digital technologies. So the validation process really lended itself more towards emphasizing digital transformation and also brought in this really important piece about modern public health challenges. How public health is responsible for, also thinking about how do we address some of those health impacts. And since that, we continue to see new digital transformations, and certainly generative AI, like all sectors, has sort of led to many people in public health thinking about this. And certainly I know in the networks that I'm involved in, public health practice networks, generative AI has brought a whole bunch of new people into thinking about digital public health and what this means for us. So I want to focus a bit, we've already kind of been talking about why now. I think you're kind of getting a sense of like why it's important to be thinking about digital public health, but just wanted to add a couple of other sort of arguments to why it's important that we sort of think about this as a field or area. And the first is really for strategic reasons, and I'll explain what I mean by that. So, I think we're all aware that digital health has been a huge focus in healthcare and in the health system for many years, pre-pandemic, and now sort of even more so post-pandemic, thinking about virtual health, thinking about apps, wearables, technologies, and sort of how they relate to health promotion. And this has definitely been a mainstay and a focus of the healthcare system for discussion. And this has led to digital health strategies. And this is sort of an image that comes from a pre-summary of the BC Digital Health Strategy, which was released earlier this year. What you can see is that public health is listed amongst all of the areas of healthcare within this sort of pre-release summary. In the strategy itself, the only mention of public health is just the recognition of IMSS-BC as a successful example of a digital health intervention. No real discussion of public health in relation to the strategy. And that's common across digital health strategies, is that public health or population health, if it's mentioned, it's usually as an afterthought or as sort of like one in a list of things, but not really with any serious discussion. So our team sort of wrote a commentary about this where we would argue that actually there is a distinction between digital health and digital public health. So that includes, fundamentally thinking about the perspective of the two, where digital health is really focused on effective clinical care and improving that patient-provider experience, and really focusing at that area. Whereas digital public health obviously has a population of public health lens. It's thinking about how interventions can improve outcomes at a population level. And it is a distinct kind of sort of entity. And you can think, we also thought about differences in context, types of interventions, and how the relevance and importance is applied to health equity as being quite distinct between the two. But we also recognize that there's considerable overlap between the two as well. And that, some of the work that we do, while some of it might be quite distinct from digital health, there's also quite an overlap in that area of digital health. So just some examples shown here where, some of the distinct functions of digital public health are things like, the surveillance and AI, social listening, some of this larger population public health type of work. Whereas sort of in this integrated space are many examples of health promotion, and much of the work that I've done in my career has sort of fallen into the space around sort of digital health promotion and provision of digital services from a public health lens and equity improving lens. So from a strategic perspective, we think it's important to start really articulating this and describing this because at the moment we're not at the table where these discussions by government, sort of like large discussions about resources around digital health, are not really focusing on some of the unique things that public health brings to the table. So that's a strategic reason why it's important to think about this. We touched on equity a little bit, and this has become, I think, even more important about why we need to focus on digital public health. So we've long talked about the digital divide for a long time, where we've talked about how access to the internet, or even thinking about skills that people have, digital literacy, pose this digital divide between people who have and don't have this access. And it's a divide people based on these characteristics. We know this is still the case today. This is just an example of showing how there remains gaps in access to the internet or high-speed internet in many rural and remote and first communities in BC and elsewhere sort of across the country. And so clearly this is still a challenge around access to internet. But I think that while these divides have been recognized for some time, really this sort of like the rapid transformation, digital transformation of society in the face of sort of this pervasive techno-optimism, and as we shift towards more digital-first approaches to how we access services, more and more people are being concerned about people who are being left behind, and through this pace. So that's led to sort of more sort of nuanced or sophisticated thinking beyond the simplicity of a digital divide, and recognizing that there's a whole spectrum of outcomes and a spectrum of different capacities people have. And this is an example from the Lancet and Financial Times Commission report on growing up in a digital age from 2021. And it's, what you can see across the top are really that even though we think about children as being naturally tech savvy and sort of growing up in a digital world, that even for youth, we have a range of people who from digitally excluded all the way through to digital immersion, and that there is multiple outcomes that are affected by this. And so I think we're sort of advancing our understanding and thinking about this, and digital exclusion has become something that many people are talking about. I think, we're also seeing more and more recognition of digital determinants of health in the digital environment. This is, as folks may be familiar with this is from the Population and Public Health Framework for BC, which was released in September of this year, where the digital environment is listed as one of the social and ecological determinants of health. But we know that these individual level determinants, digital literacy, access to the internet, are important, but they're by no means the whole picture. We can think of the digital transformation of society as having impacts on determinants at multiple levels, ranging from commercial determinants, so the role of, for example, of unregulated big technology companies and sort of the interventions that are developed, to digital changes in society that have impacts on people's income or wealth. And some people actually talk about digital determinants as being super determinants of health, because they can mediate people's ability to, around other determinants such as income, wage, employment, etc. So it's clearly a lot to be thinking about when we're thinking about the digital transformation of society. So I'm just going to touch base on where we go from here, realizing that we sort of taking a bit longer than I expected. I'll just go quickly, because I think I want to give Muyi time to really focusing on his study. But I think one of the areas that we think it's important to focus on is to think about organization and structures. So while we've had all these different pieces of digital public health, it's important that we start thinking about how we organize as a public health community around this. In the scoping review that was done, we also identified a whole number of challenges that people were identifying, both technical on the right and non-technical challenges on the left, and really recognizing that in order to sort of move forward in this space, we need to think about solutions and ways to overcome these challenges. And part of that is thinking about what are the underlying foundations or pillars that we need to think about in organizing around this. And this is sort of some of the proposed strategies that we developed through the scoping review, which is identifying just some of the fundamental pieces we need to think about. We need to think about resourcing. We need to think about healthcare worker capacity. We need to think about the public health practice, et cetera. And so I think more of this kind of like organized approach and thinking to this field is important for us to do. I think I'll just briefly mention that this has also come up internally at BCCDC with some of the work that we've done, speaking with people across different service lines at BCCDC. And many people have talked about, their thoughts about digital public health include recognizing the real potential and challenges of digital technologies in relation to health equity, a feeling of people that digital public health was sort of outside of their regular scope of work, as well as the need to be less issue responsive and reactive and to be thinking more strategically, for example, thinking about how we could have some centralized digital public health functions. I think there are implications to think through for the organization of public health. With that, I will turn it over to Muyi.
Thank you, Mark, and thanks for joining. I'll just spend a few minutes exploring the study we did, trying to see where we can go. So back to this foundations that we pulled up, we were really thinking, so what next after this open review? How can we start making dent in some of these huge challenges we're seeing? So focused on health workforce capacity building. And so through the Theresa Tam's report, we got funding for Catalyst grants to explore how we can foster workforce capacity for digital transformation of public health in Canada. And so we partnered with public health faculty here at the School of Population and Public Health, but also with faculty at the University of Victoria, the Dala Nana School of Public Health at U of T. We aim to really identify recommendations for digital competency and training for the public health practitioner of the next generation. And so we based our study off of Thomas and colleagues' 6-step framework for curriculum development. We really focus on the first 2 steps, which are around problem identification and general assessments, and then targeted needs assessment. So in this 3-phase study, phase 1 and 2 really focus on that first step of the framework, where we do a rapid review of the literature, trying to understand what the current recommendations are in the literature. And then we did an environmental scan of digital public health training programs and courses around the world. And using those 2 study outputs, we then conducted focus group discussions with Canadian public health practitioners across the country to see how we can be contextualizing some of those recommendations for the Canadian public health practitioners. So I'll go stepwise through the findings. So for the rapid review, we implemented the WHO framework for rapid reviews and conducted a search in December 2022, including papers published between January of 2010 and December when we conducted the search. We searched through Ovid Medline, Embase, ERIC, Web of Science, and in addition did complementary searches on Google Scholar and did automated forward and backward citations, searches using Citation Tracer. We did a quick screening, so 25% of the articles were screened by 2 researchers, myself and one of the researchers on our team. And then after we had established a method for screening, the rest of the articles were screened by 1 researcher. We extracted the data using a standardized data extraction tool that we had developed, and then we mapped our findings to the 2008 PHAC Core Competency Framework for Public Health. So I think there's work now going on to publish a new one, but at the time that was the de facto competency framework. So what we found was that there were only 12 articles within the literature that had clear recommendations of digital competencies or for digital competencies within public health. 3 of them were published between 2021 and 2022 when we collected. So majority of them were a little bit dated, if you think about it that way. While within the literature, we saw that there was a very acute need for digital competencies and people talked about these problems. Very few people made clear recommendations about solutions that we can have towards the problems. Just to show you how we went through, we had about 2023 returns and search, but by the time we had concluded the screening, it was only 12 articles. We can't obviously go through all the competency recommendations we found, but when we mapped them across the PHAC competency framework, we found that they mapped across all 7 competency categories that exist in that framework. We had 45 unique competency statements. While they mapped across all, potentially there was a new category of competencies that we were talking about related to management of new data streams, digital data systems, and the governance of these systems. In terms of the training recommendations related to these competencies, we also found that people were making recommendations about expanding core public health training to focus on digital technologies with opportunities for elective specializations where possible. but there was also clear recommendation around ensuring ongoing professional development programs that can continue to retrain and re-equip the current public health force to be able to use digital technologies appropriately and address problems that are amplified through digital transformation. We looked at the disciplines that were recommended for some of these training programs that were identified in literature, and alongside public health sciences, commonly mentioned practices or disciplines included public health informatics, computer science, information science, biostatistics and mathematics, sociologies and management sciences. But this is just the top list. It was a very broad range of disciplines identified. So in the environmental scan, we're trying to understand if these are the recommendations, what's actually happening in practice and how are schools responding to this need. And so we did a two-stage process for our environmental scan. We did a systematic search of digital public health training programs in March of 2023. We searched on Google Advanced Search using a specified search strategy. And we also searched on public health databases for different schools. So we looked on the Council on Education for Public Health, which is a database that warehouses all the schools of public health in the US. We looked at the Association of Public Health, Schools for Public Health in the European region, that's ASFAR, that catalogs schools within Europe and some parts of Asia. And then we looked on the PHAP website. And within all of these searches, we found 58 programs and courses that really fit within our description of programs that really focused on digital technologies for public health, whether they named it digital public. And then we looked within the programs that were identified to see how and whether they talked about inter or transdisciplinarity in any way, and sought to reach out to the schools that had that clear mandate to understand how they are organizing themselves around the idea of transdisciplinarity. So we reached out to 22 schools, and out of those, 4 program directors and course administrators were willing to talk. So we conducted interviews with them and did a content analysis of the transcripts from those interviews. So this summarizes the 58 programs we found. The majority of them were at the master's level. 70% of them were from North America, 21% from Europe, so Germany, UK, France, Netherlands, and so on. And then minority from Australia and Asia. What we found was that there were 3 main categories of programs that were being or are currently being implemented. The first is around public health data sciences. So 29 programs really focused on improving competencies for using advanced computational and statistical techniques, so AI and ML, to analyze complex data. And this was primarily led by biostatisticians within schools of public health, or in partnerships with computer scientists, mathematicians, and then public health sciences. I listed examples if you're interested. So there's the Masters in Public Health Data Sciences in Boston University, Columbia Temple, and then a very interesting program. We got to talk with the program directors at McGill and Bordeaux. It's a partnership between both schools, really focusing on training people in applied public health data sciences. The second group of programs really focused on public health informatics. Here, the programs were focused on designing and managing the infrastructure necessary for the public health data sciences. So if we have these advanced data streams, how are we managing the systems that enable them? These were mostly led by public health informaticians, collaborating with public health sciences, and mostly integrated partnerships with industry to ensure that this applied context was emphasized. The third group, which at the time we called the mixed bag, was a bunch of different programs, many of them courses standalone, commonly in Australia, that really focused on designing and implementing digital technologies to help achieve public health functions. So think about digital project management, for example. But there were other courses that really sought to equip people with the skills to understand the threats that digital transformation poses to public health outcomes at a macro, meso, and micro level. So really digging in at the digital determinants of health and giving people the skills necessary to understand and then begin to develop interventions for those threats. Examples, like I said, were LATRO and then University of North, I think, UNSW, I can't remember the meaning of that. But then when we talked with the program directors, we found that there were clear similarities within the program. First off was the idea of having a shared goal for a T-shaped professional. That was mentioned quite a number of times, and we had to go look what the T-shaped professional is. That's just one example. There are many different examples of this idea of broad understanding and knowledge, but deep expertise within one of the knowledge domains. So this example I put on the right is one for a public health professional who has deep understanding of public health sciences, understanding of advocacy, community advocacy and leadership, but still has sufficient knowledge to engage in terms of use of social media, for example, understands data and how data can improve their own understanding and application within public health sciences. And so that's the goal that these programs really had a shared commonality around. They designed their courses around the idea of interdisciplinarity. So beginning with the vision for what a graduate from that program would look like, they would design courses with that shared disciplinary perspective. So many of them implemented flipped classrooms and combined collaborative training that involved some level of practice within industry. So gaining insight into the applied context rather than just at a theoretical level. But they also all have shared challenges. First off, they had no clear understanding or shared definition for digital public health. They also had very important challenges around shared vocabulary, shared epistemological views and methods for training and research. And so they're having to work through some of these challenges. But then there's also issues around resource constraints. People come into 1 year, 2 year master's courses or 4 year PhDs. How broad can you go? How deep can you go within each of them, within the restraints that you have in a very tight curriculum? So some of these challenges were brought to the fore within our conversations. And so we then brought all of the things we had found, including the competency statements we identified and some of the challenges we had in mind, and talked with public health practitioners to see in Canada what really applies and what can we be thinking about in our context. So we did an interpretive description of public health practitioners' perspectives in Canada. We purposely sampled practitioners across the country. We're very lucky to partner with the National Collaboration Centers for Determinants of Health and the Network of Schools for Population and Public Health in Canada. And so we reached out to practitioners across the country who had at least 3 years of experience and were familiar with digital technologies within their own public health practice. Within the 4 focus groups we had, practitioners were from municipal and regional health authorities within Western Canada, so Alberta, BC. We also had another focus group exploring perspectives from Eastern Central Canada, so Quebec, Ontario, and Maritimes. And then we reserved the final group to folks working in federal agencies, really focused on equity, disability, and equity to understand what other perspectives we might bring in, especially in regards to our quest for truth and reconciliation. So we brought all of these together and did these focus groups between November and December of 2023. One of the things we did was to first off have broad conversations around challenges and barriers that they had faced within their own practice, but also facilitate us to implementing digital technologies for public health. And then we reviewed the preliminary list of competencies that we had initially generated. So what did we find? 3 main themes. The first was around the idea that public health systems must evolve to support new digital competencies. And the fact that digital technologies are currently being implemented for public health functions despite the system and not because of the system. And the idea that there are many isolated issue-driven systems being built to address specific concerns or public health concerns, and that a lot of human resource capacity is spent navigating the barriers between the systems. So for example, there are many instances of people demonstrating having to manually copy data from one system into another to be able to facilitate some of the advanced analytics that we are describing in our context. So the idea that we must be also advocating for some of the changes within the system to support new graduates from the programs that can actually leverage their skills. But then there was the idea that we need to focus on the basics before extending towards advanced competence. So we must be thinking around basics in two terms. First, basic digital literacy, which was something we didn't necessarily think outright within our studies, but the public health workforce is quite diverse. We make the onset assumption that people know how to use some of these systems, just basic things like email or online forms. We make so many assumptions, but the public health workforce, because of its diversity, sometimes may not really be able to use the skills. But then also thinking about a public health first approach. From a public health lens, how can we be understanding the digital technologies and their relevance to different practices or domains of practice within public health? And the third theme was around the idea of building general digital competencies. Everyone agreed that we need to have some level of basic level of understanding of what's going on generally, and then people can be offered options for specialization where necessary. And so the conclusions we drew from that was that there's a need for concurrent systems-driven coherent approaches to building digital competencies and the systems to support these competencies. And the Australian Institute for Digital Health, Australasian Institute for Digital Health actually has a concept called the digital capabilities approach, where they are matching the competencies within the workforce to the capabilities of the system to ensure that we cohesively build capacities for digital public health. But we also need to be thinking about that public health first approach to building digital competencies. So how can we be thinking about current curriculum to understand where there are opportunities to leverage digital technologies? And then finally, like I said, the idea that we need to be thinking about extending digital literacy training where possible. So what does this mean for us? I think I've already hinted at it a little, but we need to be advancing public health infrastructure alongside digital competencies. And this is some of the work we need to be doing in terms of advocacy for upgrades, advocacy for a cohesive strategy for digital public health within the systems. And this will rely on cross-jurisdictional collaborations where necessary. But within our training systems, how can we be thinking about improving capacities for digital public health? We need to be exploring opportunities for basic digital literacy. We need to be embedding technical and non-technical skills within our public health curricula. I think within ASFA, one of the biggest issues they're actually advancing at this time is the idea of digital transformation leadership and entrepreneurship, where people are able to not turn away from our risk-averse nature in public health, but to embrace change where possible, and especially within the digital ecosystems. We need to be providing optional specialization streams where necessary. I was really excited when I saw Amy's mail about the PhD concentration in epidemiology. We need to emphasize real-world hands-on training. I think one of the things that we heard from practitioners was the idea that we work with very clean data sets in public health schools. We work with very clean scenarios, but when you get into the real world, it's messy, and people struggle to adapt to that context. But we need to also be figuring out partnerships where necessary. So how can we create partnerships within different schools, public health, computer science, informatics, to address these complex digital public health challenges that we have? We must be engaging with health systems partners to co-design our curricula in a way that efficiently supports public health practitioners to do the job they need to do in the digitally transformed world. So for us as next steps within our own study, one of the things we're trying to do is translate some of the competencies we've identified into some form of cohesive curriculum updates where possible. So we just put in an application for the UBC Faculty of Medicine's Strategic Information Fund to help us, figure out ways to be thinking about where there are opportunities to implement some of these updates. Also exploring and characterizing some of the transdisciplinary partnerships that are necessary. And I say we, like we've already done it, we're just hoping to start some of those activities. But there's more we can be doing. I think one of the things in our own applied project we're doing is to be thinking about ways to develop a research agenda around the digital determinants of health. Last month, about 50 scientists within across the world actually published within the WHO's bulletin a new framework for understanding the digital determinants of health and how we can be thinking about its interconnection with the social, ecological, political, and the commercial determinants of health, because they're all connected. And we need to be thinking about what research we can be doing to advance our understanding of the impacts of these determinants on health outcomes. At our own conversations we've had, we also recognize the need for individual and population level measures of digital access and literacy. The most popular digital literacy measure currently in use today is the Ihoghosa measure, was developed in 2005. We talked about just the last 5 years, how technologies have evolved and changed. And so we're not really, we talk a lot about how there are digital divides and digital determinants of health impacting health outcomes, but we have no clear ways to measure these differences in outcomes. And so we need to be working with different populations to also understand these impacts. And one of the pieces of research we're doing, Mark's leading, is to work with marginalized communities to understand the upstream impacts of digital determinants of health.
Well, so that brings us to the end of the presentation. So we still got hopefully some time for discussion. I mean, we just recognize that, we're sort of two people that have some thoughts and have been thinking about this, but we know that there's many other folks with sort of relevant experience and expertise, and we really are, interested in hearing other people's thoughts. So just to say that, Muyi and I are interested to have further discussions if there's folks who kind of want to talk and think a bit more about this area with us and what this might mean for us in SPPH. And our email addresses are here if you want to connect with us.
Thank you. We have some time for questions, and Rachel will moderate the Q&A session. And Rachel, you have some instructions?
They're actually right behind you on the whiteboard there. So instructions are slido.com, and the code you can input is SPPH. I can see Dr. Birnbaum has already made it into Slido.
Anyway, so while people are looking that up, we can have some questions from the room. And
I can do.
Okay.
Yeah, thank you, Mark, for your wonderful presentation. My name is Drona Rasali. I retired from BCCDC, where I was responsible for design, creation, and launching of digital BC community health profiles, which are online, and those were developed over a number of years, like 10 years, from 2012 to 2023, and still it is on. You have presented wonderfully about the perspectives from the practitioners, educationists, academia, including the course development and degrees around digital public health. I'm just thinking about the receiving end, especially talking about equity and DOS, determinants of health. All the actions will happen in the communities, but we don't see much communities involvement in our public health strategy or programming. It is like only top down. There got to be some sort of mechanism for bottom up. And I was wondering if there has been any consideration for capacity building at the community level, like getting communities like municipalities involved in our public health activities, especially when going into digital public health. Is going to be, there have been a lot of problems with the misinformation and too much of information that has actually hampered the emotional well-being of people greatly, especially in COVID that we saw. So I think ground up, we need to build some sort of capacity at the community levels. And how can we get municipalities or other organized communities involved in this?
Those are great questions, Drona. A couple of things come to mind around that. So I think, part of this one of the strategies potentially in thinking about, I mean, even at higher levels of health promotion is kind of like not just necessarily how do we get people to be informing this work of public health, but how do we engage in other sectors where there's work happening, right? So municipalities, provinces, they all have like digital health strategies, or sorry, digital strategies, not health strategies, where there's a lot of focus on things like free Wi-Fi and things like that. And how do we sort of, intersect with that kind of folks at a more community or municipal level? Part of the reason why we're also looking at sort of digital determinants of health among more marginalized communities came out of conversations that I had with the community-based organization executive director about how at a community level in their organization, like her staff are spending a lot of time actually just coaching people in how to use digital technologies because she works with a very marginalized population. And I think that community perspective is really important to be thinking about. So thanks for your comment. I guess I see some comments from David online, which I think Muyi is going to take a stab at around the public health informatics.
Just
You want to read it out though?
Oh, sure. Yes, you can read it out.
Yeah, for folks in the room, so the question is to advance public health informatics capacity. Are there Canadian links to or programs that exist at CDC, CSC Public Health Informatics Fellowship? At this time, not that I'm aware of. I know about fellowships that exist, but sometimes they're not too well connected. Again, it's back to that elephant picture that Mark initially showed. We're working in the space, but in different capacities and not necessarily piecing out the pictures together. So while public health informaticians are really trying to promote equity in terms of access to information that we can use, it's not clear to us on this side of the aisle, how much they're doing. And so ensuring that we have those interconnections within the system will really help create clarity in the cohesive strategy. And to link that to David's other question around BC's digital public health and how it's similar or different from Public Health Informatics Institute. At this time, BC doesn't have a digital public health strategy, at least not that I'm aware of. What we have is a BC digital health strategy, which emphasizes, again, the informatics perspective. But like we have initially talked about in these conversations, public health many times is an afterthought, sometimes just an example within these documents. And this is not a critique of the public health framework for 2024, while digital environment is listed as one of the social and ecological determinants of health. Again, when you read through the strategy and the framework, little is said about how we can actually make a difference in that context. So we're just drawing a little more attention to the idea of digital public health using some of the research that we've done.
Yeah, I'll tackle the next question from Mariana that says, this is very exciting work. Are you also planning to investigate the unintended negative consequences of digital public health? And I think that's an excellent question and a really important question that we think about in this, because digital technologies are all double-edged swords, and there's like, the pros and cons to these. And certainly, that's been some of the work that we've done within, for example, our research that's been related to Get Checked Online, which is, this low barrier kind of approach that's really, people really like and use a lot. Where, for example, we've seen that like the digital literacy using even these old archaic scales of people who are repeat users of the service is far higher than the provincial average, right? So we know that, sometimes these things, while we're really aiming to sort of improve inequities, might actually just be already reaching people who are privileged enough to get access testing service otherwise, right? So I always think it's really important to be thinking with all of our interventions about the pros and cons of these. And I think, instead of being sort of techno-optimistic or just like techno-skeptical, like sort of this idea of sort of being techno-realistic and just recognizing with the digital transformation of society, digital transformations are here and we should be using them and thinking about them in public health. But we have to be really critical of how we use them and think about their consequences that may not be things that we intend. So that's a really great question. I'll also just answer the anonymous question that came in that says, have you considered how all of this relates to effectiveness and efficiency of programs and services, especially expectation of reduced healthcare workforce? And again, this has definitely been something that's come up in our research and thinking. So again, using the example of Get Checked Online, Get Checked Online avoids a visit to a healthcare provider. So actually one of our biggest sort of like selling points of Get Checked Online from a health system perspective is that, it reduces healthcare costs because people don't need to see that healthcare provider in order to access testing. And I think the the balance of this is also just being careful that we don't then assume that digital technologies replace other forms of healthcare, which has been a tendency in some places. So in London, for example, their digital testing services were created by de-investing in in-person clinical services to invest in digital technologies. And that has those impacts on equity, right, for people who can't access those services. So I do think it's a point to be thinking about, and it has been a successful argument that we've been able to make with senior level decision makers, but it always has to have that caveat that we shouldn't be seeing it as a replacement for health services.
There's a question.
Oh, a question, Amy.
I want to ask about the workforce.
Yeah, go ahead.
Because I think, first of all, I think it's great. It's timely, probably even we're a little bit behind thinking about it. I mean, for sure we're behind. Based on all of the investigation and the surveys and the collection that you did, how do you see offering programs for training being joint with other units? Because I'm trying to imagine marshaling the expertise here to be able to offer something that focuses on digital public health. It's just not something. So like putting all of your thoughts together, what would you recommend to some people who are interested in the education side? Sorry, I'm looking at you, Trevor. You know, what should we be thinking about? What should we be doing?
Yeah, that's a good question. I don't have a specific answer, to be honest. I think that first off, the idea of transdisciplinarity is becoming more apparent. Whether we have the capacity to do it within the schools, people will still go into the real world and have to operate in transdisciplinary practices, whether we like it. So that's the impetus to actually break down some of these barriers that we see in terms of negotiating with some of the other schools to create training programs where possible. I think if given all the resources, I think that would be the way to go, a transdisciplinary program. But in the interim, there are opportunities to be looking out for ways to integrate digital training within the current programs. And that was something that was accentuated in our interviews where people talked about a public health first approach. People need to understand from a public health perspective how social media can change the practice of health promotion, for example, or how apps can change the way we think about health promotion interventions, health education interventions. And so where possible, we might be thinking about maybe not going full transdisciplinary just yet, just engaging with the other schools to see how we can design some changes to our current coursework to see how they improve our delivery of services.
Okay, so let me clarify. So working with some of the other schools of public health to integrate examples, case studies, kind of on a piecemeal basis for right now.
Yeah.
Do that internally, but doing it also with other schools. And then in the future, you're suggesting that it is actually more feasible if you create the transdisciplinary training program.
Yeah.
Because that's what they're going to do.
Yeah. Yeah.
And I guess just, I know we're at time, but just to wrap up and add to that, I mean, we mentioned kind of like one of our next steps being applying to the Strategic Innovation Fund, and that's exactly the purpose of that project. And Trevor is going to be part of that if we're funded to also be thinking about like those tangible kind of like what can we do in our school around these pieces as well. So.
Yeah, I think there's been a number of other questions online, but apologies with the timing. I think there's always a lot of interest in the topic, so that's wonderful. I think we'll have to wrap up and save it for another time.
Well, all I want to say is let's applaud the two speakers. Thank you very much.